Aloha and namaste. So, in the previous lecture, we covered the first three, the prana, anna, and udaka, and then we moved on to the srotasas related to the seven body tissues or the seven dhatus. So, rasa, rakta, mamsa, meda, asti, majja, and shukra. In this lecture, we cover the final six srotasas. The first three are related to the three waste materials. So, you have Swedavaha srotas related to sweat, Mutravaha related to the urinary system, and Purishavaha srotas related to the excretory system. And the final three are two related to the female body system exclusively. So you have the Artavaha srotas related to the channels that transport and are involved in the formation of menstrual blood, and then is the Stanyavaha srotas related to the channels that again form and transport breast milk. And finally, you have the mind srotas or the Manovaha srotas. So we'll be covering these six topics today. So let's begin. Swedavaha srotas. These are the sweat carrying channels. So consider all the channels of transportation of sweat: the skin, the sweat glands, the pores in the skin, and even the thermoregulation centers in the central nervous system. So the roots of this channel are said to be in meda or medas, which is the fat tissue, and the pores of the skin, because that is closely involved with sweat production. The reason why meda dhatu is chosen of fat tissue is probably because excessive sweating is a common symptom in overweight and obese people, where there is increase of this fat tissue or meda dhatu. So that may be one of the reasons they considered the meda dhatu as a root or origin. So the symptoms of vitiation or imbalance, called Srotas Drishti, is either lack of sweating, like an abnormal lack of sweating, or excessive sweating, an excessive stickiness of the skin associated with that, excessively rough or dry skin because of the lack of sweating, even burning sensations, and horripilation, which is goosebumps. It is actually a vata effect. So all of these things are associated with the imbalance of vitiation or symptoms of imbalance of the Svedavaha Srotas. There can be many more. This is not an exhaustive list. So certain skin diseases also involve Svedavaha Srotas as well. So the causes of this vitiation or imbalance is said to be excessive exercise, exposure to heat or humid hot environments, or even people who work next to a heat source continuously, like people in factories that have a furnace or ovens. Exposure to heat and cold in quick succession, for example, having hot and cold foods taken together, or working all day in the sun and then immediately entering an air conditioned cold room, so that quick succession. Excessive anger, grief, fear, these emotions are also associated with imbalance in the Svedavaha Srotas. So the treatment principles are very similar to the treatment protocols of fever, which is termed as jwara in Ayurveda. Now, fever is a symptom, yes, but it is all in Ayurveda. Fever is treated as an entire disease condition. They have causes and an etiology and a pathogenesis and treatment protocols and for different types of fevers. So very similar to the treatment of Svedavasrotas. Then is skincare medicines and therapies, because your all your topical applications that come onto the skin are also targeting the Svedavasrotas, the pores of the skin and the sweat glands. Sweat inducing medicines are there, for example, Trikatu, which is long pepper, black pepper, and dry ginger powder taken together. And sometimes you need sweat inducing medicines. You have sweat reducing medicines, which are basically pitta pacifying medicines. This is because we know that pitta is the hot dosha out of the three, and pitta has a close relationship with the skin and of course sweating. So high pitta people will generally complain of more sweat, more body odor, more stickiness of the skin, and the possibility of skin diseases as well. Sweat reducing medicines are therefore pitta pacifying medicines. Bitter and astringent foods are also used mainly to treat imbalances of the Svedava Srotas. Topical medicines, among all of them, Udvartan, which is the powder massage using herbal powders, is the best for excessive sweating and body odor as well. Most of these herbal powders have a natural fragrance which can fight body odor and even the build up of bacteria on the skin. And Abhyanga is the best topical application for dryness which can be caused due to less sweating. So, dryness of the skin, go for Abhyanga, and for excessive sweating, there is nothing better than regular Udvartana massage. Next, we have the Mutravaha Srotas, which are the channels of the urinary system. So, consider the channels of formation and transportation and excretion of the urine. So, you have the kidneys, ureters, bladder, the urethra. So, the roots of this in Ayurveda are said to be the bladder, the urethra, and the ureters, which is quite self explanatory. The symptoms of injury to the Srotas are expansion, dilation of the urinary bladder for whatever reason, any obstructed urination at any level, it could be at the urethral level, at the bladder, or higher levels also, any pain which is localized to that system, that area. All of these come under symptoms of injury to the Mutravah Srotas. The symptoms of vitiation or Srotas Dushti can be again the extremes. So you have less urination or very excessive or frequent urination. Any sort of obstructed or obstruction in urination, either partial or complete. Frequency is increased where there's incontinence, any burning or painful urination, bleeding during urination, abnormal changes in the urine. So, if you do a urine test, you might find pus or turbidity, blood, froth, or so many other factors that we do in a regular urine exam routine and microscopy. So, all of these can come under Mutravah Srotas, symptoms of its vitiation. Now, of course, the abnormal changes in the urine, the lab reports, we are adding an understanding in today's time. This wasn't mentioned before, but you could associate all of those as symptoms of the imbalance of the Mutravaha Srotas. Now, the causes of vitiation, the first and foremost one they have said is forcefully withholding the urge to urinate. These natural urges of the body, like urination, like sleep, like this, the urge to defecate, the urge to yawn, to sneeze, to cough, these forces are called vegas, and these urges and forces should not ever be repressed or restrained, because then it can cause vata increase or imbalance of vata to such a drastic level that it could cause both anatomical and physiological uh, imbalance, which leads to disease. So that is very, very important in Ayurveda. Focuses a lot on non-restraint of these natural urges. So that is one of the most important ones, and we're not talking about this habit once or twice. It is a habit if a person continues it for a long time, because of their lifestyle or the fact that they travel a lot for their job. Over a period of months and years, it could lead to some serious disease conditions. The next is unhygienic personal care. This also is something we clearly understand, because the urine is, after all, a waste product. The opening is one of the body's openings to the external world. So, hygiene is absolutely important, and lack of it can lead to several infections like UTI and so on. Next is excessively heating foods. So, foods that are ushna or hot or pitta increasing, those foods can tend to cause a burning sensation or cause a less urination or less frequency of urination, or it can cause irritation to the bladder and the systems. It can even lead to higher risk of infection. So, again, this is not a one time thing, it is a prolonged practice of eating acidic or heat inducing foods. Next is inadequate hydration, or the other extreme, excess hydration. This is also quite self explanatory. Emaciation or any other chronic disease causing it. So, in patients of extreme emaciation, which is called as karshya, in Ayurveda, it does have an effect on other systems as well, and the urinary system is also affected. And lastly, if there is any injury or trauma to the passages or organs of this system, so it could be an external injury, it could be an internal injury, it could be the formation of, let's say, a renal calculi or kidney stone anywhere along the pathways. So, any kind of obstruction or impediment to the natural um, functions and processes of the urinary system can be considered here as well. I'm sure you've got the pattern now. It's like you'll understand that these Srotases and their vitiation, the causes and the symptoms and all, they are generalized, and you may come across in your practice so many health conditions that you can very easily fit into these categories of the Srotases. So Ayurveda here is just given a very broad outline, and they to make the person understand, they've given a few examples of causes and symptoms, but this list is not exhaustive. You can continuously add to this from your own experiences and from new diseases and situations that you come across every day. So take these more like guidelines rather than finite lists. So the treatment principles for the urinary system, first is Mutrala. Mutrala is a Sanskrit term for diuretics, basically those that have a positive action on the entire urinary system, the kidney, the bladders, everything, and help to improve the natural flow of urine through the system. And of these, there are two herbs that you definitely need to know about. Again, very safe to use, very popular even in the West, in the US and UK as well. Punarnava, which is Borrelia diffusa, and Gokshur, which is Tribulus terrestrius. And I'm adding one more, which is more like a food product, which is Dhanyak, which is your coriander, or you could also use cilantro. So Punarnava is by far the very best Ayurvedic herb, which is a natural diuretic. And Gokshur is a very close second, which has a good action on the entire all the organs and systems involved in the urinary system. So Gokshur is like your go-to herb uh, if you have any disease associated with the urinary system. It could be kidney stones, it could be burning micturition, it could be UTI, so many factors, right? So these two are two herbs that you have to think of. You can give it plain just as they are in tablet powder form, or you could make a combination of Punarnava and Gokshur and ask your patient to consume fresh coriander leaves if they can get their hands on it, or cilantro leaves, possibly soaked in water for some time, so like a cilantro detox water, or they can get their hands on coriander seeds and boil those seeds in water, cool it down, and have it. So it's very common here in India, even in hot summers, to flush out the toxins via the urine. This coriander water is quite popular. And the rest for specific diseases, the general treatment protocol for a disease in Ayurveda called Mutra Krishra is an umbrella term for dysuria, and the treatment protocol for that has to be followed. So there are internal medicines, there is intake of ghee and oils, and there is panchakarma detox therapy also given depending on each specific condition, and surgery wherever it is needed is also recommended. Next is the Purishavaha Srotas, or the excretory system. So, consider the channels of formation and transportation of feces. So, you have the colon, the rectum, the anus, and also the upper digestive tract, because, yes, the formation of and the separation of wastes and nutrients happens and starts from there. So the roots are said to be the roots of, or the origins are said to be in the colon, the rectum, and the anus. Again, this is quite self-explanatory and understandable. Now, the symptoms of vitiation, again, the extremes, excessive defecation for any in terms of quantity or frequency, or less defecation as well. Constipation is one of the most common symptoms of vitiation, hard stools, or sticky stools as well. Bleeding, pain, any burning sensation or discoloration that is abnormal, flatulence or defecation with a lot of sounds. This is the way it's described in Ayurveda. Foul smell, that a lot of sounds is because of the vata or the gases present. Foul smell, again, more than normal, frequent or poor bowel control or incontinence of the bowel, and of course diarrhea as well. So these are the very basic symptoms of vitiation. There can be so many more. Basically anything that is unusual or separate from the normal functioning of this excretory system. And another thing to note is that the colon basically is the site, or the greatest site of vata dosha. It's closely associated with the colon. Basically vata dosha is closely associated with things leaving the body, so the waste products leaving the body, especially the digestive system, is associated with vata, particularly apana vayu, which is the vata responsible for elimination. Now, the causes of vitiation or imbalance, similar to the previous Srotas, forcefully withholding the body's natural urge to defecate or to pass a bowel motion. So, that is one of the most important and, quite frankly, very common abnormal habit that people generally do. It could be because their job requires them to travel a lot, or for any other reasons. So this is one of the primary causes for diseases like hemorrhoids or fissures or constipation or chronic indigestion as well. Second is excessive eating, or eating before the previous meal is digested. So this is also very important. um, we must give enough time for each meal to be digested and assimilated by the body, and avoid overeating. It causes indigestion, as a result of which elimination also suffers. Excessive consumption of heavy or dry or greasy food. So too dry can also cause flatulence or gases, and too greasy foods can be difficult to digest, which leads to indigestion and sticky stools or constipation. Prolonged indigestion can also upset the quality or formation of the stools, and thereby elimination as well. And in general, having a weak agni or a weak digestive fire. So this is at the level of the stomach and the duodenum, you could say. But still, if the agni at that site is weak, then food is not properly segregated into wastes and nutrients, and it can affect the eliminative system as well. And in extremely emaciated or anorexic conditions, the bowel movement is also affected, and a host of conditions are quite frequently targeted. It can range from constipation or diarrhea or um, pain in during defecation, so many conditions. Now, the treatment principles of the Srotas are condition specific. So, you treat constipation, diarrhea, flatulence, sticky stool with a different set of herbs and therapies. But the primary thing to understand first are three things. Firstly, you treat the Agni, which is very important, as this is the root cause of any imbalance. And the way to treat Agni or the digestive fire is to use Deepan and Pachan, which I have already covered under Annavaha Srotas in the previous videos. Deepan basically means all the herbs that are carminative and improve appetite, and Pachan are those that improve digestion, assimilation, and general metabolism. Second is the treatment protocols of diarrhea and constipation are supposed to be followed here. So basically, Ayurveda treats both these diseases as a full-fledged disease conditions with their own symptomatology, their own medicines and therapies. So if you follow the protocols of diarrhea or constipation as given in Ayurveda, that could also be the line of treatment. And thirdly is to do a colon cleanse through mild virechana. So the easiest herbs to do this with, and very simple mild laxatives I would say, are Trivrut, which is Operculina terpentum. There's Triphala, plain haritaki, which is one of the ingredients in Triphala, so haritaki is good. Kutki or Katuki is also a very good, very effective herbal laxative. It's just a single plant. Something as simple from our foods also can be used, like soaked raisins. Castor oil as well, edible castor oil, just 2 drops applied on your bread or your food could also help. Senna is Ayurvedically processed. Senna is quite commonly used a laxative herb, not just in Ayurveda but in other systems as well. And when we purify it the Ayurvedic way, then it's one of the effective herbs as well. And one formulation that is again commonly used, even Banyan Botanicals and other brands in USA sell this formulation, is Avipattikar powder. So Avipattikar is like the go-to laxative that also has a effect on vata and reducing excess pitta as well. So Avipattikar is something you can really look out. It's slightly sweet, so it's palatable, and a go-to mild uh, colon cleanse. Okay, when I say virechana here, virechana is actually the term for a panchakarma procedure involving purgation, but this is not as intense as that. This is mild virechana using simple laxatives. Our next Srotas is the Artava Vaha Srotas, or the channels of transportation of menstrual blood. So here we have to consider the pathway of flow of menstrual blood, that is from the uterine canal to the vaginal orifice. Also, Atharva in certain contexts means ovum. So ovaries, fallopian tubes are also part of the srotas. Basically, the parts of the female reproductive system that are involved in the formation of the ovum and the transportation of this ovum, the formation of menstrual blood as well, which is why the origin or the roots of the srotas are said to be in the uterus, and of course the arteries supplying it, which eventually convert into menstrual blood. I mean, the blood brought by these arteries are eventually add to the formation of menstrual blood. So the symptoms of its srota dushti or vitiation imbalance are primarily infertility, as we understand that the formation of the ovum and everything responsible through that process has an effect on fertility. So infertility involves the athavasrotas directly, and it is treated primarily in cases of infertility. Then there are others like dyspareunia, intolerance or difficulty, or experiencing pain during sex. It could be amenorrhea or dysmenorrhea, menorrhagia, excessive flow, any other menstrual disorder, and even disorders involving the other organs like PCOD, which is very common. So, when these diseases come to us in any patient, we are treating the Artava Vaha Srotas. So, the causes of vitiation imbalance are basically vata and kapha for dysmenorrhea and amenorrhea. The reason is that vata, again, like I said in the previous Srotas, the downward flowing vata, the subtype apana, is responsible for elimination, things going out of the body. So even menstrual blood that goes out of the body comes under the zone and the functioning of vata. But kapha can also, if kapha is deranged, then that can also affect the quality and formation of menstrual blood and contribute to conditions like dysmenorrhea or amenorrhea. In pitta, if pitta affects the Atava Srotas, we see diseases like menorrhagia, excessive flow of blood or excessive bleeding, PID, which is pelvic inflammatory disease, vaginitis, so itis meaning any kind of inflammation, infections, those kind of things are associated with pitta. So all the three doshas can contribute to different types of diseases. In general, an unhealthy diet is very commonly found in patients suffering from Artavaha Dushti. So having junk foods, having foods pumped with hormones or genetically modified foods have a huge effect on Artava Srotas as well. So this is important. So this is important to be asked during your history taking. Not only following the lifestyle prescribed during menstruation period, but there are even the foods that are prescribed during the menstruation period. If you don't follow those guidelines, which are in Ayurveda called Rajaswala Paricharya, then it could also lead to diseases. So this Rajaswala is basically the menstruating woman, and Paricharya is the regimen that they should follow. So there are a series of things. You should eat light food, you should sleep on a comfortable bed, you should take adequate rest, and those kind of personal hygiene should be taken care of. Those kind of guidelines are given. So not following those guidelines could cause a whole range of diseases associated with menstruation. So the treatment principles have been briefly said in one line. Follow the treatment protocols of Yoni Vyapad. Yoni Vyapad are a series of diseases, at least 20 are mentioned in Ayurveda, with a scope of many more, uh, related to all the gynecological disorders. So it's an extensive study and it's usually done by specialists in that field. It would be difficult to cover all those here, but the protocols that are given should be followed to treat different types of diseases. The Yoni Vyapad are detailed gynecological disorders given in the ancient texts, and it ranges from treatments of amenorrhea, menorrhagia, vaginitis, fungal infections, STIs, infertility, irregular cycles, conditions like PCOD or uterine tumors and fibroids or endometriosis. All of these have been described in certain contexts, and the treatment protocols for them are outlined. The herbs to be used, the therapies to be done, the type of diet to be eaten are also prescribed. Next, we have the Stanyavaha Srotas. Stanya is the Sanskrit word for breast milk. So, the channels of transportation of breast milk are also considered as a Srotas or a cistern. And here we have to consider all the channels involved in the formation and transportation of breast milk. So, the lactiferous glands, the lactiferous ducts, and the nipples and the opening as well. So, by logic, obviously, the origins and the roots of the Srotas lie in the breasts. The stanya is the breast milk and it is considered a byproduct or subdhatu or an upadhatu of rasadhatu. So the rasadhatu, which is the first of all seven major body tissues of the body, the first is rasadhatu, which is formed from immediately from the food we eat. So you could equate it to the immediately processed food, the plasma, the liquid content in the body, the lymph, all of these are comparable with rasadhatu, and it directly leads to the formation of stanya or breast milk. Means your food is closely associated with the formation of breast milk and the nourishment of the stanyavaha srotas as well. Now, the causes of vitiation, like I said, the food is closely related because rasadhatu is the first dhatu to be formed after food is digested. So, and rasadhatu in turn forms a part of stanya or the breast milk. So, heavy food, overeating, and indigestion can cause imbalances in the formation and flow and quality of breast milk in lactating mothers. Especially eating stale or very highly processed foods like packaged foods, ready to eat noodles, and which have a lot of additives in it, or very highly salty foods, those kind of type of packaged foods are seen to have the greatest effect in the formation and quality of breast milk. The third is obviously malnutrition. If the mother is not having enough of food and not enough of nourishing food, then that could also impact the formation of breast milk. If the lactating mother is suffering from chronic or infectious disease, interestingly, Ayurveda has mentioned if there is a lack of love and care towards the child, because the fact that the mind is so important in the formation and entire process involving the hormones that cause breast milk to be made. So that is also considered here, and if the mother does not have that attachment to the child, it could also restrict the flow of breast milk, or the formation or the quantity reduces. Again, if there's any mental stress or the person is suffering from postpartum depression, that could also possibly reduce the quantity of breast milk. Alcohol is mentioned in Ayurveda because it existed at that time. Nowadays, we can also consider stimulants and things like caffeine or caffeinated drinks or coffee, smoking, and drugs can also affect this. And any other factor that affects rasadhatu. So, if you go back to the rasavaha srotas and you see the causes of vitiation there, you can associate all those causes to affect the stanyavaha srotas as well. So the symptoms of vitiation, they are either excess formation of breast milk too much, or and especially if it is not expressed, and or less formation of breast milk. Others are breast pain, which is also a common complaint. Low quality of mother's milk, like the milk is being formed but it's not nourishing the baby enough, the milestones of the child are not being achieved, all those kind of things, or the child is suffering from colic or constipation, those kinds of things, because of the low quality of mother's milk. Often in such cases, for example, a patient whose child is suffering from chronic and frequently passing gases, in such case, if you treat the mother and give her herbs and medicines to correct her digestion, the quality of her breast milk will improve, and that will reflect in the child as well. So you need not always treat the breastfed child or the breast child that's breastfeeding. Sometimes treating the mother can also improve the quality of breast milk, and that reflects in the child as well. So Ayurveda, or if a neonate or a baby that is feeding comes to you with simple complaints and conditions, we also try to treat the mother as well, because we see that effect when the quality of the mother's breast milk is improved with the use of Ayurvedic herbs. The other symptoms could be abscesses or tumors, mastitis, or fibrocystic changes of the breast as well. So let's get to the treatment principles. First is Stanya Janan, and the second is Stanya Shodhan. So basically, in these terms translate to Stanya Janan are terms for galactagogues. So those that increase the formation of breast milk, the production of breast milk. And Stanya Shodhan is the second type of herbs, a group of herbs that are dedicated to detox the breast milk. So there's no problem with quantity here. We're trying to improve the quality of breast milk. So we use a set of herbs that have that effect, that detox or purify or improve the quality of breast milk. Those are called Stanya Shodhan. Stanya is breast milk, Shodhan is to detox. And the first one, Stanya, means breast milk, and Janan is to produce, to create. So as simple as that. You, depending on the condition, you could choose both of these groups of drugs, or you could specify one particular set of herbs. So the herbs that increase the production of breast milk or galactagogues, the best of these are Shatavari, which all of you all already know is Asparagus racemosus, perhaps the best, the absolute best galactagogue that there is, and it's also very good for the hormones of the female body and hormone regulation. It's also excellent herb to take during pregnancy and prepare for lactation as well, and definitely must be had by mothers during the entire process of lactation. Shatavari is also given in amenorrhea, dysmenorrhea, and other gynecological conditions. Okay, a very popular one. It's called Asparagus racemosus. You can find numerous studies on Shatavari. Next is Yashti Madhu, which is Indian licorice, uh, or Glycyrrhiza glabra. This is also known for its properties to improve the production of breast milk. So food wise, things like red rice or brown rice is known to improve breast milk. Milk, of course, I'm talking about dairy milk here, cow's milk or buffalo milk is also known. For vegans, you can go for plant milks as well. Although the efficacy might be reduced in comparison to dairy milk, it is still a viable option. Vetiver is vetiver roots, so that is also quite popular. You can find this as well, vetiver. It's called ushira in Sanskrit. Then there's a type of grass called the darba grass. Unfortunately, this grows primarily in India. I'm not sure if you'll get it in the US, but it is a part of many ready-made medicines that are designed for Stanya Janan. So those medicines you will certainly get in the US. And a group of herbs called Trina Panchamula, which are basically the roots of five grassy herbs, are known to improve breast milk. Again, this is not something you can collect from your garden easily, especially if you're living outside of India, but you can definitely get ready-made medicines from a host of pharmacies and have this as one of the ingredients. So all these good ingredients are usually put together to create natural Ayurvedic um, galactagogues or medicines for lactation, and you'll find almost most of the brands that are selling in the US may have one product dedicated to this. And now we come to the final Srotas from all the ones that we've covered so far, which is the Manovaha Srotas. And the reason I've kept this for the end is because it is not an anatomical Srotas. We have to understand this as purely physiological. So consider it is a psychological plane basically, but still in Ayurveda the term Srotas has been used, the term channels have been used, and it has been grouped with all these anatomical systems just because it is so very important. So basically it means the psychological plane, and consider all the functions of the brain, okay, and the mind and the psyche. So the roots are said to lie in the organ called the Hriday. Now, Hriday directly translates to heart, but here we have to consider its synonymous use for the brain or the mind. Okay, so Hriday just mainly means the main center. So, in this context, we will not take the anatomical heart here, we will consider the heart of the body, which is the mind or the brain. And this other root is the Dasha Dhamani, the 10 great channels originating from the Hriday. So these channels are again, it could mean the nerves and the brain tissue and all of those involved in the creation, formation, storage of thought and the processing of the thoughts by the mind. So when we say that the Srotas are channels that carry things from one place to another, we must understand here that the mind cannot be carried by anything, it is intangible. So the Manova Srotas is a figurative description of the channels that carry our thoughts and the channels of the mind. Consider these channels the flow of sensory and motor information and the thought processes. So the symptoms of vitiation of the Manavasrotas are all the psychological and somatic disorders or symptoms, any aberration in the normal psychological well-being of a person. So considering this, not only psychological but psychosomatic disorders that have a somatic cause are also included. For example, diseases like Alzheimer's also comes under this purview. It involves a degeneration of brain tissue, but that also comes under this because the effects that are seen or the symptoms or signs that we see are related to the psychological imbalance of a person. And the involvement of the two mano doshas, that is the rajas and the tamas doshas. I'm not using the word guna here, I'm using doshas because when you're talking about disease, it is rajas and tamas, the two forces of the mind that are responsible for diseases of the mind. Okay, the third guna, sattva, is never a dosha, it's always a guna, meaning something good, because sattva is good and beneficial for the person. So rajas and tamas, if it goes out of balance, can cause a lot of diseases. So the causes of vitiation are wide ranging. It could be emotional discord or emotional imbalance, social discord, trauma. It could even stem from lifestyle, from diet, from external pathogen, from degenerative changes. It's very wide. Okay, basically the involvement of rajas and tamas dosha or reduction in the good sattva guna of the mind. Due to this also, they're all interconnected. You could see that, count these as the causes of vitiation. So the treatment principles are basically, the first one is Sattvavajaya Chikitsa. I have already covered this in the Manas lectures, live lectures that we have, so you will find it in detail in your notes. But going through it again, Sattvavajaya Chikitsa is basically Ayurveda's answer to psychological counseling and therapy. So it involves support groups, psychological rehab measures depending on what the situation is. So it's different for, let's say, depressive states. It's different for mania or maniac states and those kind of things. So it's basically a list of guidelines to psychological counseling. The next is using Medhya drugs. Medhya drugs are herbs that act on mental functions and herbs that improve brain function. The next is Panchakarma, which is your detox procedures, but it could also involve other nourishing or strengthening procedures like Shirodhara, where the oil is poured onto your head in a continuous stream. Nasya, which is instillation of medicine via the nose or the nostrils, and Shiropichu is like where you keep a piece of oil soaked cotton pad on the crown of the head and let it soak in. So all these oils which address a mental disease are generally infused with herbs and medicines that are known and have been studied and researched to improve brain function. So these therapies can also be used. You'll find more details of this in the Manas live lecture notes. Next is Achar Rasayan, which are the moral life guidelines, and Sadvrita, which are the proper social conduct. So that also is a very, very important, and we need to educate people or help patients, especially psychological patients, imbibe these guidelines in their lifestyle. And of course, yoga is of primary importance in treating psychological diseases. So I may have shared this Sanskrit verse with you all before, but I'm reiterating it here. It goes, Dhi Dhairya Atmadi Vijnanam Manodosh Aushadam Param. And it basically means there are three things that a person needs to keep in mind. One is Dhi, which is Buddhi, which is intelligence or intellect, the ability to differentiate between right and wrong, or what is good for you and what is bad for you, or the right manner in which to behave or the wrong manner in which to behave, to discriminate between these. The second is dhairya, the courage to take the right steps, to give up the wrong and to start implementing the right. And the third is Atmadi Vijnanam, which is the knowledge of self. Understand what works for you and what you need, and that you are unique, and maybe something that applies to someone else may not apply to you. So, figuring out what works for you can only come through knowledge of self. The ability to act on that can only come from dhairya or courage, and to know what action should be taken comes from developing one's intellect or buddhi. So, these three things are the best medicines to cure all manodosha, meaning the disorders of the mind. So, with that, we have completed the different types of srotases, an introduction to their origins or the roots, the causes of their imbalance, the symptoms, signs, and basic diseases involved in their imbalance, and the general treatment principle related to them. Going on, if you all ever come across Srotas in any other context in your Ayurvedic studies, you'll be able to easily fit what you have read into these basic guidelines that I've given. If you encounter a patient in your practice, you'll be able to dissect any disease in front of you and fit it within the scope of these different Srotases. And it really helps to figure out what type of treatment to go ahead with. I hope you enjoyed that lecture as much as I enjoyed talking about it. The concept of Srotas may seem a little difficult at first, but it will certainly help you when you actually start examining patients, and it will give you a clear idea about what types of herbs and treatments to use. At the same time, it gives you an opportunity to compare the modern systems, any modern investigations or examination of the patient and disease from the modern perspective, and compare that with the Ayurvedic physiology at every instance. Again, if you have any doubts or you need any clarifications, please feel free to reach out to us. Until the next video, aloha and namaste.